Hi, Dr. Tracy Tyson, general pediatrician, and I wanted to talk about something that happens commonly in teenagers, especially girls, called vasovagal syncope. I'm sure everyone's heard that someone vagaled or someone had a syncopal episode, they passed out. So it's not an uncommon term that people know about it, but what is it? There is something called the vagus nerve, and the vagus nerve does a ton of things, but the simplest way to understand what it has to do with this is that it helps control your blood pressure and heart rate in response to changes in position. When you're sitting up, it takes less pressure in your body to get the blood flow to your brain. When you stand up, your body has to compensate by increasing your heart rate, increasing your blood pressure to keep the pressure in your brain consistent. It's something called the cerebral perfusion pressure, and it's how our brain gets oxygen. So this is happening every millisecond. There is constant adjustments going on in the vagus nerve. And there are certain people who are prone to the vagus nerve. I always say it kind of goes, sorry, I forgot to do my job for a second. That cerebral perfusion pressure or blood flow to the brain goes down temporarily, and the body's response is to pass out. So the person can turn gray, white, they can have their eyes roll back in their head, they pass out. There's even some people who have some jerking movements that can look similar to a seizure, but then they come to pretty quickly. They might feel tired, like they ran a marathon. Everything else seems back to normal, and they usually have some symptoms beforehand, like I feel dizzy, I don't feel very good. So this is not an uncommon problem. It's very scary and hard to watch, but it is treated with increasing your natural blood pressure. So if your blood pressure is already naturally a little higher, when the vagus nerve forgets to do its job, you're less likely to pass out. So increasing salt in your diet, increasing your hydration so that your blood pressure is always nice and juicy and high, so you're less likely to pass out. So hope this helps somebody understand it. There's a whole more conversation we can have, but this is kind of the nitty gritty so that when someone talks to you about vasovagal syncope, you have a little bit better understanding what it is. Take care.